My name is Mary Kellner. I am the Administrative Assistant for Employee Benefits for Valley View School District. I will be going over your employee benefit information today. As a new hire, you are entitled to be offered the employee health, vision, and dental benefits along with group life insurance and long-term disability. First, we'll review the benefit information. All full-time employees who are eligible and/or enrolled under the employee health and vision and dental plans are provided with access to the VVSD website. This website contains all information and forms under the Insurance Department tab. You will receive your permanent insurance cards in the mail directly from Blue Cross Blue Shield of Illinois and IMED within 7 to 10 business days of processing. All benefits that we offer are effective the very first day of work. There is no waiting period. So the first day of full-time work will be your first day of insurance benefits. You will end up with 3 ID cards total if you enroll in everything: 1 medical, 1 dental, and 1 vision card. First, we'll begin with our dental insurance. Our dental insurance is through Blue Cross Blue Shield of Illinois. It is a PPO plan. A few things to point out in regards to our plan. There is a $25 deductible per person, up to a maximum of $75 for the family, and a maximum calendar benefit of $2,000 per person per calendar year. Our schedule of benefits, it's a pretty standard dental plan, not too much to really point out. However, preventative and diagnostic is covered at 100% of the eligible expenses, twice a year within 6 months of each visit for your cleanings. Restorative, endodontic, periodontic, and oral surgical services are covered at 80% of eligible expenses after the calendar year deductible is satisfied. And lastly, crowns, inlays, onlays, prosthodontic services, your major work is covered at 50% of your eligible expenses after the calendar year deductible is satisfied. One thing to point out is orthodontic is not currently covered underneath our plan. Our premiums, they are deducted from your 24 pays over the plan year. Single coverage is $2.71 per pay. Employee plus one if there is only one dependent eligible in your household, $10.42 per pay, and then family coverage will be $20.83 per pay. Our health insurance that we're going to review next is also a PPO. It is also through Blue Cross and Blue Shield. We will review the prescription drug health plan, the vision plan through IMED, which is provided to you at no cost when enrolling under the medical plan. In order to get the vision, you must be enrolled under the medical plan. And then we will also review flexible spending accounts. Valley View School District is a self-funded plan, which means that the district pays all the claims. Although you receive a Blue Cross and Blue Shield of Illinois ID card, the insurance plan is actually the school district's. The plan is created by the administrators and the teachers union. Pre-tax medical, dental, and premium payments. Upon enrollment, you will have the opportunity to take advantage of the current laws and regulations to save taxes on the following: your premium payments for your group medical and dental coverage. What this means is you can choose to have your premiums taken out prior to any federal or state taxes being applied to your pay by payroll, which brings down your gross taxable income. You can choose to do it post-tax, but most do it always pre-tax to get that tax savings. The PPO Network. Through our claims administrator, Blue Cross Blue Shield of Illinois, the district has access to their PPO network. It is their largest network available. Therefore, most providers are covered underneath it. However, if you have specific doctors or specialists that you utilize, you will want to check with them just to be on the safe side that they are still remaining in network. You can do so by going to the VVSD website and clicking on the insurance tab and following the prompts to get to the PPO provider locator link. Or you can contact your provider directly and advising them of the Blue Cross Blue Shield PPO plan and if they are participatory in the network. Inpatient hospital and outpatient hospital benefits. Currently, for our plan, there is a $250 copay for emergency room services. This is waived if the patient is admitted directly from the ER. PPO in-network hospital is 90% coverage for in and outpatient, and out-of-network coverage is at 60% coverage. Again, you can find your network providers by going to bluecrossblueshield.com and click on Find a Doctor or Hospital, or by visiting the VVSD website under the Insurance section. Diagnostic, outpatient, X-ray, and labs. Again, in-network is covered at 90% subject to your deductible, and then your out-of-network is subject to 60% coverage, again, subject to that deductible. Urgent care and facility visits. Urgent care, we do not have any co-pays on, which I do like to point out. Urgent care itself for in-network is covered at 90% once your deductible is satisfied, and urgent care out-of-network is 60%. Annual maximums, we do have certain services that have a benefit visit maximum on a calendar year basis. What this means is if you use your maximum visits, for example, for chiropractic, we have a 30 visit maximum. You use your 30 visits by November 1st, you will be unable to receive more covered services for that chiropractic care until January 1. Any visits you do over the maximum are not covered under the plan, and you are responsible for 100% of that cost. So for our benefit maximums, as I mentioned, chiropractic is a 30 visit maximum per calendar year. Physical therapy is 110, occupational is 28, and speech is 19. These again run on a calendar year basis, which means from January 1 through 12/31, and then they will reset. For physician benefits, our office visits are at a $30 copay. Individuals are $1,500 out-of-pocket maximum, including the deductible on an annual basis, and families are $3,000 out-of-pocket maximum, including your deductible on an annual basis. This does not include any excluded charges incurred in excess of the maximum benefit as recently discussed regarding such as benefit visit maximums, and charges incurred for services and supplies covered under the dental care portion of the plan. Wellness and preventative care is also provided under our plan. Our medical plan covers in-network preventative care for eligible adults and children at 100% with no deductible. Because we do believe good health is important for you and to be at your best at home and at work, we encourage you to take advantage of the preventative care benefits that include routine exams, health screenings, vaccinations, and more. We also, on an annual basis, provide a wellness exam in district where we bring out a vendor, Empower currently, to do a well exam at each building throughout the district. We have 10 buildings that usually are available, and we send out information in regards to that in the spring. And as long as you are on our medical plan, you may sign up to utilize this benefit to have that blood draw taken at no cost to you. Next, we'll review the birthday rule. All benefits under the plan are available to your dependent children if you enroll them, but the benefits of the plan are with the parent whose birthday falls earlier in the year if you decide to double cover them. So for example, one parent is born March 25th, the other parent is born July 6th. Does not matter on the birth year. The parent who was born in March will be the primary payer of the benefits. So if you're going to cover them again under the medical, both of you, the medical parent with the parent with the birthday earlier in the plan year will be the primary payer of the benefits. One major thing we need to point out on our plan is we have what's called a working spouse eligibility for AFT and administration provision. If your spouse is eligible for group health insurance through his or her employer, he or she would not be eligible to participate in the VBSD health and vision or prescription drug plans. If your spouse is not eligible to enroll in an employer group health plan, he or she may be eligible under VBSD's health, vision, and prescription drug plan, providing the employee has submitted all necessary documentation. This includes a working spouse affidavit, an inquiry form, and then additional required documentation as indicated on the affidavit. If this does apply to you, you can contact HR. They will provide you with the additional forms listing the required documentation in order to certify your spouse is ineligible for coverage elsewhere to enroll them on our coverage. Our prescription drugs, mail order is mandatory for maintenance medication underneath our plan. What that means is if you take something on a regular basis, that you will have 3 retail fills at the local pharmacy. Upon that 4th retail fill, you will be forced to go to mail order. These forms that you can find for the mail order are out under the VBSD website, under the insurance tab and prescription drugs. If you are unable to locate any of the information, by all means, feel free to contact me directly. My email is listed also out on the VBSD website. Or you can come to the PowerPoint presentation that will also be listed and you'll be able to find it there. Alliance RX and Walgreens Plus Prime are is our prescription drug vendor. If your dependent children are primary under the district's medical plan, they would be eligible to participate in the prescription drug program. If your dependent children are secondary under the district's medical plan, they would not be eligible to participate in the prescription drug plan. Our current prescription drug costs for retail pharmacy up to a 34-day supply, your generics are at $0, so they do not cost you anything. Formulary is at $40 and non-formulary is at $60. For mail order, which you will get 3 months of coverage benefits prescriptions for a 2-month price, generics are still remaining at $0. Formulary is $80 and non-formulary is $120. Next, we'll review the iMed Vision coverage. Again, this is a free benefit provided to you at no cost by the district. You must be enrolled on the medical coverage in order to receive the vision coverage. The vision plan itself is pretty standard. This presentation that you're going to be looking at does have some of the information listed on there. There is a much more detailed sheet of all the different lens options and lens enhancements listed on the VVSD website and in the packet provided to you from HR. But some of the basics you need to know is an eye exam is $10 in network every 12 months. You can get prescription lenses every 12 months, and in network they are typically a $25 copay for single, bifocal, or trifocal. Frames you can get every 24 months and are allowed a $130 allowance with a 20% discount over and above that $130. There are different lens enhancements, as I stated, and contact lenses are also allowed in lieu of glasses every 12 months. Those are also offered at a $130 allowance. Premiums for your health insurance. These are also taken across 24 pays and are $62.79 per pay for single coverage, and then family is $174.42 per pay. Single obviously is one person, family is 2 or more participants. The life insurance is provided to you at no cost through Valley View. It is through Liberty Mutual. This benefit is 1 times your annual salary. All you will need to do in order to complete this portion of it is to complete your beneficiary form. Make sure you list your beneficiaries that you want eligible. Definitely under the primary. If you have a secondary, you may list them underneath there. If there is no secondary, that is okay. But be sure to sign and date your beneficiary form. We will also review your flexible spending account. Flexible spending accounts, or FSAs, let you set aside part of your pre-tax pay to use for out-of-pocket medical expenses like copays, deductibles, dependent daycare expenses. The money you put into the account is deducted from your paycheck before federal and most state taxes are taken out. And if you don't pay taxes on the money when you use it to pay for medical expenses, we do offer both options. You can enroll in either the Healthcare FSA or the Dependent Care FSA. How it works is we utilize PayFlex. The plan year for us starts on January 1st and goes through December 31st. Enrollment is only available during open enrollment at this time. So as a new hire, you will not be able to enroll just yet, but upon open enrollment in December, you will be sent out information in regards to flexible spending. Our open enrollment is December 1 through December 14 for a 1/1 effective date. Information is sent via email and also mailed to the home, so you will not miss it. And we do post it also on the VVSD website. With flexible spending, there is a use it or lose it rule. If you don't utilize all the money in your healthcare FSA by the end of the plan year, any balances over $500 will be forfeit. So to be sure you set aside only what you need for your eligible expenses, there is a calculation sheet out on the VVSD website that will help you decide what expenses you might have throughout the year to guide you on how much you may want to set aside. One thing to note, you can't transfer money between FSAs, meaning the dependent daycare or the flexible spending account. What you contribute, say, to your FSA must remain in your FSA. It can't be transferred over to your dependent daycare account should you have excess of money at the end of the year. Dependent daycare accounts must only be used for daycare or elder care, and can't be used for medical expenses, and you can't change your elections throughout the plan year except qualified changes in status, just like with your insurance coverage, such as marriage, divorce, birth of a child. If you have a Section 125 major life event as those, you have 31 days in which to notify the insurance department. You can call, you can email, or stop by the ad center. Again, it's 31 days for a major life change in order to make changes to your insurance elections. Healthcare FSA, the money you contribute towards your healthcare flexible spending account for out-of-pocket expenses for yourself or your eligible dependents are such as medical, dental, vision plan deductibles and copays, office visits, and outpatient expenses not paid for by your plan, prescription drugs, and some over-the-counter drugs used to treat illness or injury if prescribed by your doctor. Currently, we have a $2,750 maximum contribution, and you can also look for a full list of eligible expenses on the irs.gov website. For the Dependent Care FSA, the money you use to contribute towards your FSA for your qualified dependents qualify for your dependents under the age of 13, your dependents who are disabled, your elderly parent if you provide more than half your parent's maintenance costs throughout the year. This maximum is $5,000 annual contribution or $2,500 if married and filing separately. Expenses for care for qualified dependents are only eligible if the care enables you to work. Examples of this are such as before and after school oasis programs or care, regular daycare, or even summer camps may qualify. One thing to point out with our FSA program is we do not currently utilize the debit card option. However, if you are enrolled in the medical, dental, and or vision plan, you are able to utilize an option called the no claim form option. This allows you to check off that option at open enrollment when enrolling in the FSA option, and Blue Cross Blue Shield and IMED will talk to the carriers twice monthly and will auto reimburse you for any expenses they've seen that have been processed out of pocket. This does not unfortunately qualify under the dependent care option. Open enrollment. Open enrollment is your annual opportunity to review your benefit choices and make any changes if necessary. It also allows you the opportunity to elect and participate in the flexible spending account as we discussed for the following calendar year. This must be elected annually for the following year, meaning open enrollment, if you're not making any changes to your medical, dental, or vision options that you have currently, you do not need to submit any forms. However, if you wish to continue to participate initially in the flexible spending, you must make an active election every year and complete that form and remit it back. A few things to consider. Certain dental procedures have waiting periods before you are eligible for benefits. Please refer to your employee dental benefit plan booklet if you are having a certain procedure done. You cannot change your medical or dental enrollments or the money you elect to have pre-taxed for an FSA until the next plan year unless you have a major life change, and that must be submitted within 31 days of that major life event. Examples of these life events are marriage, divorce, birth of a child, adoption of a child, spouse job loss with coverage loss, or a spouse new job with coverage. Again, you will need to notify within 31 days in order to process changes to your coverage elections. A few more things to consider. The health and dental plans use the birthday rule to determine the eligibility for dependent children. Refer to the plan booklets if you have questions or to contact me directly. And only those dependents who are primary under the district's medical plan will be included as dependents for the prescription drug card program. This is our overview of our Valley View benefits available to you. If you have any questions, feel free to send me an email at kellnerme@vvsd.org, or you can give me a call at 815-886-2700, extension 6015. Thank you.